Nagar. My clinic name is Vismit Eye Care and Polyclinic. Uh, Today I'm going to talk about myopia awareness in children. Myopia basically means a short-sightedness, wherein the child is not able to see for a longer distance. Most important over here is to figure out at the right time and to treat it. The most difficult part for all of us as parents is to pick up when the child is not able to see and to come to a doctor for the help. So there are certain signs and tips that I would want to give to all the parents, which can help them to understand and bring their child to the doctor at the right time. First, if you feel that the child is constantly rubbing the eyes, okay, so rubbing activity can suggest that the child is not able to see clearly and hence he's trying to rub to see things. Second is if the child goes very close to the TV or any kind of a gadget. Because he's not able to see clearly, he will go very nearer to the objects to see them. Third, if you feel that the child is not showing any sort of concentration, like there's a lack of concentration, either when he's studying or when he's viewing things or when somebody's talking or when you ask them to look for a far distance and they just let it go. Okay, so these are few basic tips that should be picked up by the parents. Certain signs that there are certain signs and symptoms that can be picked up is one, if the child starts getting frequent sty. Sty is basically a lid boil or a pimple in a layman word. So if you see that the child is constantly getting this kind of symptoms, you should approach a doctor. Secondly, I always insist that all children should have a regular checkup, first at the age of 3 years and second by the age of 6 years, which is a preschool going time. Because as parents, we may not pick it up. As doctors on examinations, we definitely have a good opportunity to pick it up at the right time and treat it. Lastly, during the pandemic, as all we are going through during this COVID era, I would only want to say that the gadget, especially the mobiles, are the worst gadgets to be used. So if ever you want to give your child or expose your child to any form of gadget, the best would be a TV, followed by the desktop, followed by the iPads, followed by your TV, followed by a mobile. Mobile is the worst thing to be given to a child. So if possible, please make it a point that you give least amount of mobile exposure to the child. And also remember that we are seeing a lot of cases in children these days because of excessive near activity, especially the screen and the mobiles. So just follow 3 tips before I end my talk over here. First is every 20 minutes of the screen time, ask your child to take 1 minute break. Either close eyes or look at far point. Second, make them frequently blink your eyes because blinking helps to relax the eyes and also reduces the stress on the eye and reduces the dryness. And third, last but not the least, not recommended by many, but I definitely feel you should provide your child with a 0 number Blu-ray glass so that it acts as a protective barrier for your child in front of the screen. That's it for today. If you require any guidance, any help, you can definitely contact me anytime. Thank you.